Welcome to everybody. I'm so glad to see all of you here with us this Wednesday. Today's conversation for me is an exciting one because several years ago, prior to coming to Casey Family Programs, I was a senior deputy with Supervisor Yvonne Burke, whose district included the Magnolia Community Initiative. And way back then, there was a lot of, this was really new and innovative, right? Like thinking about having a group of agencies work together on behalf of children and families in a different way, right? And so to be here today, to showcase and have a conversation about what we've learned from this initiative over time and how it continues to build, I think is heartening for me. But I think the initiative continues to be really an important approach as we work with children and families. So I'm just really excited that we're here to have a conversation and to learn about the beginning of an initiative, about the reflections and how it's grown over time. So let's get to it. I want to introduce you to our presenters. Oh, sorry. So our intentions for this learning series is really to bring together folks from across the state to have a conversation. Typically what we do is give you a lot of information to think about, but today is a conversation. We want to invite you in to ask questions because our hope is that you apply what the Magnolia Community Initiative did in Los Angeles to the work that you're doing in your counties with your partners and stakeholders. So we want to make sure that today you are part of the conversation and ask lots of questions. Next slide. So let me introduce to you our presenters. First is Marta Morales. Marta is a program specialist, facilitator, and trainer with the Children's Bureau. Alex Morales is a Prevention Mindset Institute partner and the former CEO and president of Children's Bureau. Ron Brown is the current president and CEO of Children's Bureau of Southern California. And Tara Parham is child support specialist at LA County Department of Child Support Services. Kush Cooper, president and CEO of Implematics, will facilitate this conversation. I'm going to turn it over to Kush.
Thank you, Dana. So today we are going to talk about, well, the title of the talk is primary prevention implementation. Right? But really those are fancy words to inquire into. What does it look like when you set up a primary prevention system or a primary prevention landscape that supports the health of communities and support the broader proactive goals related to preventing family stress, the symptom of which are child maltreatment, domestic violence, other forms of family violence. How to target a community's protective factors and social determinants of health without necessarily even calling them that. And how to, after the community has told you what it needs and how it wishes to be treated, then how can programming be effectively realized as guided by the community? And then ultimately, we'll have a conversation about, well, how did you know? How did you know it worked? How did you know you prevented child maltreatment? You know, in our research circles at the university, we debate a lot about how do you prove that something didn't happen? And we're going to talk about how Magnolia Community Initiative negotiated that. So I'm going to turn it over to the MCI team here in a moment. And normally you'd be staring at me while I'd be saying this. But today you're looking at a family. And this is, Alex will say this to you later, but this is not about consultants and service superstructures and contracts. This is about the families that make up the community. So first, I'd love for the Magnolia Community Initiative team to talk about how'd this even come about? Where'd the big idea start? Who started the conversations? How did you come from nothing to something? All right, Ron, I'm going to turn it over to you, and you can move through it as your team sees fit.
Yeah, thank you, Kush. And actually, I'm the two-bit player in this. It's Alex that was the driver of this process, but I had joined Children's Bureau in 2000, and they were going through a strategic planning process. Alex and I were the staff of that. And the question really was around the organization's mission, which was about child abuse prevention. And really, what more can we do? And the board really asked the question deeply. And with that, I'll respond to Alex and say, Alex, and to take it from here, you could talk us through this whole process of how it all emerged. Alex?
Great. Greetings, everyone. And I just, through this conversation, I hope you are able to see part of the lessons learned, that we really learned our way forward into what has been created at Magnolia. If you're going to build a house, you have all your architectural drawings, and then you begin by your foundation, and then you start your outer structures and you build from there. I know when I'm using my Waze tool to help me navigate directions, it says, well, go this many miles here and then turn right and join this freeway. This is not a plan, and this is something that needs to be grown organically based on the circumstances, based on the assets and the partners who come aboard and the various owners who share in developing the direction. So I want to say humbly that when Children's Bureau began, we had no idea that it would become what it is today. That is not where we began. We began with the question, how can Children's Bureau advance more of its prevention work? And with that, we came up with a paper that surveyed the community and surveyed the field to discover just how complex families' problems were. And whereas we were focused on child abuse and child neglect, we learned that families are at risk of serious health problems, of not succeeding in their education and falling into the criminal system and homelessness. We discovered the economic challenges of the community. And that led us to then realize that whatever we did had to be broader than the issue of just addressing child abuse. So what started off as child abuse prevention became eventually growing into child, family, and community well-being. But that's not where we began. we began with the idea of developing a building that would support a wonderful family resource center. But we didn't realize that what we would eventually do would become outside of the building and in the community with the community, as opposed to everyone being invited to come to the building. I'll stop with that. And Ron, you were there too, and you may want to comment more about, well, how we started in that initial step.
Yeah, thank you, Alex. And so, one of the things that really was important to us was this thinking of how do we bring in supports for community that the research that Alex was talking about indicated. And so we looked to say, we were going to build this family resource center, but we're going to build it intentionally with space to co-locate organizations whose services complemented those things. So we went out and found an FQHC, a federally qualified health clinic, to come in. We found an education partner, the organization that had the regional Head Start contract, to participate. We found a bank to provide a financial education kiosk inside. We found a lot of different people that would be willing to come in and provide that spectrum of services that we saw at that point in time were quite necessary to meet those needs of the community, those things that the community had reached out and that we were hearing. And so we started this with a building for co-located services that was spectrum wide and that were complementary, because we knew automatically Children's Bureau didn't have the capacity to provide all of those, nor did we want to. That wasn't our bailiwick. So how do we engage, and how do we find partners that are willing to think differently with us? And that question there kind of started to blossom. Alex?
I think again, how things wound up was not where we began. If you think of the evolution of family resource centers, the early family resource center was one organization that used its space to invite other organizations to come and use the facility for perhaps maybe a legal aid service would come on Wednesday nights and provide legal consultation for the community, and you'd have different specialties. That was FRC's 1.0, and FRC's 2.0 became one that had shared space with shared partners in a building. Ultimately, we became an FRC 3.0, which is one that really not only had a center that people came to, but it started engaging with the community. And several things took us that direction that we hadn't thought of. Originally, we were going to invite private sector organizations to come into the center. But then other folks said, no, you want to get government involved. And so we started figuring out, now, how can we approach government to become a partner with this? And we started to look towards leaders that we have known in the community that were working on children's planning for our county. And eventually they said, you need to talk to the chief executive office in Los Angeles County, the CEO's office. And we developed a growing dialogue with them about the possibility of them becoming partners with us in this effort and the other nonprofit organizations in the community. But that's where they said, well, who are you going to be serving? And at that point, we identified the surrounding neighborhoods, and they asked for the demographics and the number of people involved in those neighborhoods. And as we identified that, the CEO's office said, that's too small to for us to become an active partner and to participate in your, as they saw it, neighborhood center. And that a radius got larger and larger as we discussed. And eventually it grew to 5 square miles around the center, which really, that's one of the most densely populated neighborhoods in the entire country. That 5 square miles holds 100,000 people, 35,000 of them are children, and 10,000 of the children are under age 5. And when we got to that number, then the CEO's office said, we will partner with you. With that, the CEO's office directed 3 of its county departments to begin to join in partnership with the initiative, to come to the center itself and physically be present. The Department of Child Support, the Welfare Department, and we also were involved with the Mental Health Department, and eventually Public Health became a partner in this. So we had our historical relationship with the Department of Children and Family Services. So these were the groups of county folks, and we eventually got city folks, including the Los Angeles Police Department, to become a partner in what we were doing. And so that's how the catchment area that we were serving became really substantially large. And then as we understood that area, that was not one neighborhood. That's maybe 15 different neighborhoods that we were serving. And it became more apparent, how can one center reach 100,000 people or 35,000 children? And we were going to need new strategies for doing that. Ron, I don't know what else you might want to add on this theme of the initial beginning as we try to share the story.
Yeah, thank you, Alex. And that's exactly right. And of course, as we mentioned earlier, we were attracting other agencies that weren't part of the building itself, but were engaged in helping to move the outcomes of those 5 square miles. And so we, that is exactly how things started to evolve a little bit differently. I'm going to shift the conversation briefly away from even our plans, if you will, because when we talk about creating a partnership with the county, we have a space there that's really 250 square feet where 3 different county departments reside. That's like 3 cubicles, if you will, 4 cubicles with a concierge inside. And that's Department of Child Support, Public Support, and DCFS, as Alex mentioned. And on with us today is one of the individuals that came in to that space, a county worker. And so I wanted to ask Tara Parham to come in and speak just a little bit, take a few minutes to talk about her experience in coming into that space. So just to frame that, again, this is one single small space for 3 different departments in a county where they think of co-location as being on different floors in the same building. And that's the best that the community can see, or in buildings that are close by so that community members need to travel from one place to the next. So Tara, would you mind sharing a little bit about your experience now?
Yes, no problem at all. Yes, this was back in, I think, '09 when I first came to Magnolia. And it was funny because someone mentioned Supervisor Yvonne Bradwick-Burke. She had just moved my department back into her neighborhood, which in '08. So we had just landed back into perfect timing. And so in '09, when I heard about this, I was so excited because I was always a community advocate. And so talking about coming in now with 2 or 3 other county departments, like Bron has stated, we were all in the county, but we did not really communicate. Just because we were in the same building, that was our idea of communicating, right? But this pilot here was so exciting because not only were we communicating, we were in the same office. We were really co-workers, co-located all together. And so we had to figure out how was this going to go, because I was child support, there was DPSS. Who do we report to? what are we gonna, who, if we needed supplies, how do we handle all this? And so we came up with this idea that DPSS was the largest, so everything was going to funnel through DPSS back to Magnolia Initiative, Community Initiative, and then the CEO would get everything. So that's how we began to set it up. DPSS was our major point. Everything came through them. The payments all was split, and then CEO got everything from them. So that was the thing there. When we came into the building, we had to learn about what each of our departments did, because again, we were all silo. I only knew what child support DPSS knew, and that was our only concerns. But I would say that Magnolia Place helped us to not understand that we were all involved in the lives of the same people. And so we needed to not only know, it's almost like walking or driving straight. Even though you drive and you're going forward, you have to look around. Your peripherals are very, very important. Your eyesight, if you couldn't see to the side of you, you would have real trouble. And so bringing us into this same space helped us to get to that point. And we began to learn about what each department did. We did have to break down how would we funnel the people in. There was one window, one door. How would we know if the person at the window was child support or DPS? But because we came in and we now understood we were one. We were not child support individually, DPS individual. Yes, we did that job, but we were one. Not only helping us to know that we were one in our county, we were one now with Magnolia. And I think that was the biggest win of all of us, because when they gave us their initiatives, what they really wanted to do with the same children that we were handling, we brought in everything they did. We were on, the talking with them. We met with them. We went through empathy classes. I can remember it back with going through our empathy classes. We were able to now, when we came, we had never done this and still don't do it in office enough, but we were never able to come into and ask, just to get to talk about how we feel today. So we can know if maybe you should wait to 10 to talk to me or things of that nature, being authentic. So, being together there in that space and learning all of the things that Children's Bureau had to give us, we were able to learn that. And I can remember one of the biggest takeaways. I remember when you guys did the book, we were doing the reading. We were talking about reading. We wanted children to learn to read. So we had this reading project with books, and Children's Bureau has a library. And so our suite brought in a lot of books. And so what would happen was someone would come in for DPSS. And I call it the IRT, right? This is like impact in real time, right? We did all of the impact for the children. It was in real time. So a parent might come in for DPSS, but say the child is going around. So if I wasn't doing anything, I didn't have a client, I was able to read to the child because we were all a part of the whole. It was a whole. It wasn't just doing what we wanted to do or our department did. It was actually doing everything together. We included our department, we included all of the departments from the county, and we included what Magnolia was doing. And so that reading time was just so special. And to have a worker there reading to your child, but you're there with another worker doing something else. And so all of those things, it just shifted us. You're talking about county government. You're talking about bureaucracy. We don't do it this way. We had to take into account if I was, one of the biggest things I still remember, and I'm so glad we went through this and was able, ourselves, the people that were there from the county was able to come into classes and talk with Children's Bureau and come up with these themes or see what was happening to us, what we didn't do, and how do we go into doing it. We were talking about domestic violence. How do I get to that question when I'm talking about child support? That was one of the biggest things. But because we had those conversations together, everyone was able to say, hey, I don't know how to do that. And we came up with this, we would call it ACT. I think I forgot what the acronyms was it?
Plan, do, study.
Yes. PDSAs. And we came up with, hey, let's do a PDSA on how would the county bring in asking a parent about domestic violence when I'm talking about child support. And that really opened us up from outside of the county world into the community world and giving the children and the parents exactly what they needed.
Right.
I think one of the things I remember um, Tara sharing that in general, the private sector refers families to the public sector. But here was a public agency team that knew deeply about its private sector supports, and they were making referrals now to the private sector supports versus just to government. So
Yes.
there was such a two-way street of connecting resources together.
And one of the biggest thing about that, I still call it that, it was called the warm handoff. You know, we weren't just chunking them over to another agency. It was a warm handoff. And we went over that process and what that mean. And if they were in the building with us, we would actually carry them over to the next building or to the next seat. Everything they needed was a one-stop shop. They didn't have to move really. We did it all. It was so convenient, because you think about a parent that has 5 or 6 children, and you're talking about going from a one bus stop to a whole nother building. Even if it was 3 miles, that's a long ways with 3 children, right? 3 younger children. So that was a lot to take into account, a lot to make it so accountable now for this parent that didn't have to move. Everything was already done for them. So that was so convenient. And I think
I want to stress that, you know, again, you're capturing the power of this unique facility that hosted many organizations. But eventually, as we started to recognize this is 5 square miles, this is 100,000 people, not every partner could be in the building, we started figuring out how we develop web connection of care support, where we could hand off to each organization, even if they weren't in the building. And we started finding hubs in the community that families knew and trusted. They could be going to their parent center, and their parent center was part of the network. So there was no wrong door of how you could receive help and be connected to the network. Even though you touched one organization, you essentially were touching all of the partners.
yes. And I think one of the other things that we have to be real in is when we came together and had all of these different county departments, it had to be representatives from these county departments, from every network partner that was about of that one goal. We had to think alike. So yes, there were different ones in the suite that maybe, I won't say didn't make it, but was not a fit. And we had to find the right fit. You really had to come with that mind to change, or to have that heart to really, really work within these confines, to work within, actually wasn't a confine now, you were working in freedom, you know, where you can go outside the box. We were so boxed. We were so used to being boxed, and we were afraid to actually go outside. And so sometimes it didn't work for every worker. And we graciously, you know, released and got the right ones that wanted to do that and wanted to be a part of. That's so important. Everyone has to have that same mindset and that same thought in order to do that. And that might take a minute, but it's worth it getting the right people.
As we evolved into this, you can see that we went from a service delivery mentality, which wasn't the original concept anyway, but even deeper into a community engagement mentality and how to do it more broadly with other organizations. And we brought those organizations in as partners in this, whether they were in the building or outside of the building, because of course, as Tara said, we're asking questions that are tough to ask. We have to have at least a place to direct people. So you can ask a question that you don't have a place to go to. And we knew that from the very beginning. So we started building partners. We started building relationships that people were being attracted to this. You hear from Tara's voice, the level of excitement that was already present. And so we were feeling that around us. And you know, again, we're talking about 2008, 2009, this was happening. So 13, 14 years ago, this was very, very significant language. The warm handoff language really was starting to evolve. This whole idea of being community well-being concepts were just evolving. And we really embraced this by bringing people together. And it was not our original intention, as Alex mentioned, when we raise the money to build the center, to bring co-located services. It wasn't our intention to create the Magnolia Community Initiative, by the way. It's how it evolved.
And just to punctuate that, it was more than just typical service organizations that you would say, oh, I'm starting to get an idea of who your menu was of network partners. Well, that community was heavily Catholic. And so we went to the Catholic parish there, and that Catholic church was really the leader of all the other Catholic, of the entire Catholic parish there. So they pulled together, working with all the other Catholic churches in the 500 blocks. And one of the large Catholic churches there served 10,000 parishioners. It had 70 small Bible study groups, and it allowed they had their Bible study leaders come learn about the Magnolia Community Initiative, so that parishioners who were in their Bible study groups wanting to find support or help, even though they were coming there to be part of a Bible study group, they ultimately could be connected to what was going on through the partnerships and the initiative, and not only receive help, but become part of the agents of helping their community. So I'm just trying to stress the variety of groups that became part of the network partners.
So let me tell you a little bit about how this continued to evolve. So we got this idea of working in community and with community that came out. And so about MCI, and that again, MCI is the eventual acronym. It was Magnolia Place Community, Magnolia MPCI, now it's MCI. And it's really about improving population level well-being and doing it at a community scale. And Alex talked about the 500 blocks, and we're trying to rethink how resources and residents can work together and strengthen the families, and really working within a larger framework of organizations. And just to be really clear, organizations participate in this in an unfunded way. No organization was paid to participate in MCI. They brought their skill set, they brought their thinking, they brought their partnership together, but they weren't funded partners in this because there was no entity paying for this other than the funds the Children's Bureau raised to pay for backbone supports of MCI. Next slide. And then, of course, what we came up with this concept, it's our focus really was on nurturing parents and good health and financial stability and educational success, with the whole idea that we're building a stronger community. And of course, again, I go back to this was over a decade ago, and now we call those the social determinants of health. That wasn't language that was being used at the time, but those were our target areas. And those were the areas that other agencies were willing to engage in. And as you can see, if you're an agency working and committed to helping support a community, what you do fits under this umbrella. So the idea is to create an umbrella big enough that everyone can fit under, and everyone has a piece of this, and everyone can own it collectively. So we created some objectives, and those were to evolve the systems of support activities and communication, both within organization and community outcomes, to build a network of support for residents and to act as a positive force, to strengthen parents' abilities to manage their children's needs and promote their development, and to develop scalable and sustainable solutions. And then the idea of that is that we want to think about how we work together and how we bring up ourselves and spring together, but to keep them connected together, to create glue. The glue then became the backbone support that Children's Bureau provided. But again, those were privately raised funds for us because nobody pays for this work. And we facilitated this from a step away as Children's Bureau. We didn't want to be the beast in the middle of the room. We created supports, but the people that were supporting this from the Children's Bureau staff, if you will, They were the people that I used to tell our board of directors, their mission is different than Children's Bureau's mission. Their mission is the hope and dream statement that the MCI provides for the community. And so we really have to look at how to stay connected and how to move beyond just small efforts, but really look at how to move together collectively and more powerfully together. And again, this is an evolutionary process. So as Alex mentioned, we started thinking co-located. Now we're thinking bigger. Now we're starting to think of, oh, as Alex mentioned, how do we engage community different? How do we bring in community differently than we had in the past? And what does that mean? And what does that say? So, you know, we really try to figure out what community embracement meant and what the voice of community needed to be. And with that, Marta, would you mind coming in and stepping in and talking a little bit about your experience? And I bring Marta Morales in because, as you saw in Kush's introduction, that she's an employee of Children's Bureau. But let's not, Marta started out as a community member. She began as a community member. She was a volunteer. And eventually she became an employee. So Marta, would you come and just share a little bit about your experience as a community member first, and then how this evolved for you?
Hello, everybody. Sorry, I was started talking. I didn't have mute. For me, as a community member, you know, when I came walking through the doors of Children's Bureau, I was looking for a place where I could connect my son, you know, where we could connect and grow more stronger as a family. I found the library program, you know, and it was just a flyer that I found at church. I was looking for some programs. I went to church office and I saw the flyer of the Magnolia place. And, you know, it was a very good resource. We got to, you know, meet many members there. You know, we were getting to connect with the community, connect more with my child. And there were many other programs that I was able to participate in. So I started, you know, joining the other programs as a mom with my child of 6 months. And I started to grow more connecting in the community. I saw how strong it was for us to connect with other parents, with other members in the community. I would see the importance of how it is important to be strong, have strong, and to feel empowered in the community. I saw how Children's Bureau will always encourage that. They would, you know, offer us workshops, open doors, you know, for other programs, for us to become members of the community and to advocate for our children. So I had the opportunity to participate as a parent facilitator with the community program. This is a community program that I was there as a mom with my child. And then I always offered the opportunity to take a 3-month training where I became a parent facilitator. I wanted to give back to the community. I wanted the community to know about these programs. I felt that closeness with the community because I was part of it. I would go and, you know, advocate for these programs, invite families to come, you know, for them to learn about this Children's Bureau Magnolia Place. I lived in the community of Los Angeles and I didn't know about it. So I wanted the families and my friends and the members in the community to learn about them. And this was a way of me giving back to the community and making sure that our families know that we could empower more our community to help them open doors, to learn about resources that we have right around our corner. You know, we want to make sure that our children are more successful, that they get to be, you know, learn more, to know that these programs are here for us to become a stronger family, a stronger community, you know, for us to feel empowered and advocate. There is a word that I learned a lot at Children's Bureau Magnolia Place, empathy. You know, empathy to know, you know, to put yourself in someone else's shoes. And I feel that, you know, that helped me a lot become a better mom, a better community member, a better worker. You know, I feel very empowered. I love what I do. I feel that, you know, starting as a member of, you know, community member, then little bit by little bit volunteering, you know, being there to support a lot of our families in the community, getting to know that they see me in the community. We see each other in the markets, we see each other in the park. We want them to know that we are here. You know, we could make the difference. You know, we could help our children be more successful. You know, we could prevent child abuse. We could prevent domestic violence. We just need the support and the resources, and we need to find them. We need these more of Children's Bureau, Magnolia Place. I always felt welcome. I always felt heard, and I feel that is very important. You know, we go into Children's Bureau, and there's always a smile. You know, we feel that this is a place where we could come with our children and read a book. You know, I always see, you know, the library. The library is always very welcoming. We have a place there where, you know, we could connect with other families. We could feel safe. This could be our second home. We want to ensure the community that this is a place where they could feel safe, heard, and understood. You know, they have all the resources there, you know, and also if we need something else, we refer them. You know, we make sure that they are not just a number, that we want them to feel that they're a family. We all are a family. We are there for the same purpose. We want our families to succeed, to be stronger. You know, we want our children to thrive. We want them to be the best they could be. You know, it's not easy. You know, it takes a village to raise a child. So we are that. We want them to know that we are there for them. You know, I feel very honored, you know, to be a community member, to be a family. And now, you know, in front of the program that opened the doors to me. You know, I am in front of the program, Enrichment Community Program. And for me, my families are very important. All of them, they are. I want them to see me as one of them. You know, we have that connection, you know, and I feel that, you know, being there, it just empowers the families and knowing that they could, you know, they could thrive, they could be better. And doors opens, and, you know, volunteering, it's beautiful to be volunteering in the community. And I see that in my families. You know, they thrive, they are empowered, they advocate for their children, and that's something that we want all of them to do.
Yeah,
Um,
Thank you
thank you,
so much,
Martha.
Martha.
I'm sorry.
Oh, sorry. Go ahead. Go ahead, Ron. I was just
Oh, no,
gonna.
I was just saying thank you as well. Go ahead.
Okay, so you know, I think we're getting a feel for the world of the beginning, the organic beginning, and I'd like to move us to so then how did you set it up, like the some of the nuts and bolts of it. But before we do that, if anyone on the team, and Ron, you know, you can pick who does that, or you can do it. Could you just articulate some of the most surprising insights, or re-articulate, because we've touched on them at this stage of the game, and then how that sort of shifted your transition to building it?
Yeah, you know, Alex, why did you go first? And I'll you know, Tara shared kind of her perspectives, and
I think one of the
yeah.
the early challenges was this initial spark, and I like it to say it's a spark. Children's Bureau was not the founder, it was a spark with this question of what can we do to advance child prevention, abuse prevention, and it turned into this. We realized that we needed to form a partnership and or to be part of a shared partnership that had ownership in this. This was not one organization, the Children's Bureau, leading this or owning this. This was not government convening or owning this. Government strongly anchored this as through its CEO department. But UCLA was also a key part of the backbone, and 70 other organizations were part of the partnership and Children's Bureau. And we all, the first start, there were about 35, 40 organizations together came at the invitation of what can we together do to help the well-being of our community in all these different areas. And we agreed to voluntarily try to align the resources that we had, particularly the resources that we had upstream in a more prevention way versus just downstream. But Magnolia Community Initiative is not just a prevention initiative, but it has a heavy emphasis on that front end. But the key is the shared ownership, not just one organization. Of course, Children's Bureau has that wonderful family center. And so a lot of people think about things as Children's Bureau because they see the name on the building and they come to Summit Children's Bureau program. But again, people were coming to all of our partners, including our faith community partners in this.
And thank you, Alex. And to that end, that was one of the big epiphanies in the middle of this. It's not about us, by the way. It's not about us being Children's Bureau, us being people, but us collectively. And so if you're come to the building, you'll see at one point we had big, huge letters on the front that said Children's Bureau. And we said, no, we have to take that down. We put big, huge letters now that say Magnolia Family Center. And in small letters underneath, it says Children's Bureau, only because that's our headquarters for the agency. But we actually had to reverse this thinking a little bit. The epiphany was, it's not about us. It's really about the community. And how do we engage with the community? And that at that point in time, the community meant the people that live there, the context experts, because they live in the community and context matters every time. And then the organizations that are working together with community and are willing to work together with community in a different kind of way to think about what more can we do and to challenge ourselves every step of the way. So one of the key components of that is creating an environment where we could think together, where we could trust each other, where we could challenge and not blame if something didn't work out. Because as you heard, we didn't come out this with one, to Alex's point, one architectural plan. This was being, we're flying in the plane while it's being built because it was all a progress, and it continues to be a project in progress because we're learning every step of the way. And it is more about the journey with a vision of a better best destination, because it's not a place that we'll land on and stay at. Because once we get there, then we've stagnated and it'll be too late. So we have to keep this moving forward and thinking about this all the time. So that's kind of the reflection that I have.
Okay, so then let's move to we've had the idea, we have our partners, folks are excited, CEOs, you've got backing. So now there's something to go build and evolve into. There's a future to live into. How did that go?
I think, and Ron can elaborate on, well, then what is going to be our theory of change? How are we going to then make the change occur in the community? And the idea of the protective factors started to become the vehicle for how that change was going to be made. So, Ron?
Yeah, thank you. And I'll change the pace a little bit. I'm going to move through some slides and walk you through this thinking process. But again, this is part of an evolution. So drawing from the best evidence and theories across sectors, engaging with agencies across the country, by the way, not just locally, trying to think of what they were doing. And that led us to this, what made us unique. The next slide really talks about that. We are looking at this as a holistic approach. We're looking at real-time data, what's happening today now. You heard Tara talk about Plan, Do, Study, Act as it's the Deming model of improvement that was created in the 1960s for cars in Japan. That's basically the way we do healthcare in the United States now, is how to learn quickly. So speed is important. Next slide. And then that's right. And then making sure that we have community connections, that there's feedback loops all the time, training ambassadors in the community to foster relationships, and then sharing our knowledge across agencies, but across the community as well. As you heard more than a few times, doing this with a sense of empathy and understanding of who the other people are that we're working with, whether they're community members or agencies, and supporting all of our staff to do this and to think this way collectively was really a very, very unique approach. So again, we came out with this collective commitment to improve outcomes for all of our children's community, all of our community's children. As you heard Alex describe that, we had 65% were living in poverty, 35% are overweight, 78% not proficient in reading by 3rd grade, and 40% not graduate. Those are big statements. So we started looking at this and thinking, well, how do we listen, learn, and get stronger, and listen to parents and other residents to empower them as agents of change? Because, if it's all about us, then it's still all about us. If it's a service delivery model, then it's all about us delivering a service, and it's handing you something and then walking away. It's not a comprehensive, community-based, intentional approach. And so we looked at this and we thought, well, what more could we do? What can we do to listen, learn, and get stronger? And we came up with using data for resident and community engagement. So we started out with looking at things like community dialogues and mapping the local community neighborhoods. As Alex said, most communities, we come into this with our thinking that they're small, they're bigger pieces, but actually community defines us. And I'll show you a little bit about that. And we do community surveys. We brought those in, and then we introduced the results of the early development instrument, and I'll talk just shortly about that as well. So we started out with our community dialogues, and what we'll do, we brought people together in the community. We created an environment to share with them. We had a space where people were trusting to come in. We used all the organizations that were participating in MCI to drive community members into the facility, reminding you that 500 blocks are big and that people had to come and travel to get there to have this language. And so we're going to talk to more neighbors, and here we're going to be good examples. So we're creating community connectedness. We're also creating community belonging in these dialogues. So integrating ourselves with community so they're seen as part of it, but not the voice of agency, the voice of community. So reflecting those voices. Counseling as a means of personal help and creating a norm for that where it's not stigmatized, and forming groups that can be done community-wide to make things better, and providing the opportunity for police involvement in a safe space for community where they're not seeing that as oppositional or as authoritarian, but really as partnering, and then making positive changes in the home and creating connectedness amongst neighbors, and then really working on personal resiliency. So again, we're talking about protective factors here, just as simple. So the next slide kind of shares a little bit about how we've done and how we were doing community dialogue. So these are people in our main conference room sitting together, creating an opportunity for connection amongst themselves. And then we decided, here we have this mapping exercise. So this is basically the blocks, the 500 blocks and those 5 square miles. And you can see that it's bifurcated by 2 freeways. And there's a whole lot of different kind of legal stuff where you have different representation by legislative initiatives and even board of supervisors. So this area is no man's land. And so we're in the middle of no man's land, and we decided, let's map this out. So the next slide shows you a little bit about the messy process of that. And so we have this board where you can see, oh my gosh, here we are with this community. What you can anchor on are the two freeways that bifurcate it. And you see that we've gotten these names of these little communities that are starting to grow. And these are the community members naming their community, not us. We didn't know any of this other than, you know, it's West Adams and Pico Union of LA. So now we're trying to see a little bit more differently. And the next slide shows you a little bit more concretely about how those are. So each one of those blocks that's outlined in blue has a name to it that's over on that far right-hand column. And so you saw that some of those communities expand outside the catchment area that we have created. And then there's one in particular that we don't have a name for, but is still part of that community. And you could see how community members see themselves as opposed to how we see community members or government or anybody sees them, but how community members see themselves. And how important is that? So what that leads us to is a few reflections on this. So the process really is about understanding how community sees themselves and creating a relationship with the community during that process, bringing people together to create social connectedness, a sense of belonging. So they now belong because they've created their own community name collectively together within this environment. And they start sharing it with their neighbors and start looking at that as a different kind of approach. And how can I now own a little bit more? Nobody was paid to be in this meeting. Nobody was paid to come to this. We made it as easy as possible during times that were easy as possible, provided childcare and food and all the rest. But people came to this because they want to invest in their community. Alex, do you have any more reflections that you want to make on that before we move on?
Go ahead, Ron.
So, you know, the impact of that really is that we started a movement then. And what does that mean? So, you know, we were really, you know, looking back at the movement that we created with community members and through community members to engage differently and to start talking to their neighbors. And what this did is this brought this whole concept of intentionality. So when we talk about protective factors, understanding that we need to strengthen them, how do we bring intentionality to the things that we're doing as service deliverers to be more intentional? You talked, Tara mentioned earlier about asking difficult questions across the spectrum for people that are in need of help, and how to make sure that we're asking bigger questions than just the single thing that they're coming to you for, because we know that that community needs are bigger and broader than we first see. But also it's about engaging with them, because when we engage with them, we actually find out that they have strengths, and we can build on those strengths, and we can ask them to offer those strengths to their neighbors and to participate in a bigger way if they have the ability and the willingness to do that. So what we've done in this is created this whole idea of how to stay connected and how to build a sense of belonging within a community. So then our next place is, how do we measure community level change? Now that we've created this, what do? You know, we know that it's an emerging field, and that changing culture takes time, and interventions need to be consistent over a long period of time and intentional, as I said. And we have to learn as we go, because we, if anything, told us, as you've heard all along so far, we didn't have a plan for this. We just let it evolve. And as it evolved, community became more and more engaged. And so, and reminding ourselves that all of us, including the members, the community members, are doing this all voluntarily. So we took this and said, well, we're gonna figure out how to share data. So we created a parent survey. We created run charts. We created dashboards of things that we were doing in the community. And then we took collective action around those things in order to support the work that we're doing. We had some subcommittees where, parent surveys for all the parents that were participating in agencies within the initiative, and bringing them together and learning across those to say, these are our strengths and what are we doing? And then using run charts to see how we're progressing, and organizations getting these run charts back to themselves to see how they're looking at themselves. Again, this is done with no blame. No, there's nothing attributed to this when the arrow goes down, other than, look, this is what's happening. Let's try and figure out why this is happening. And then creating dashboards so that we can see them more comprehensively, because we're collecting a ton of data around this. And of course, it's really hard to measure community change at the community level. So we're looking at very specific things. And then we're bringing community members together to share with them. So this isn't agency-centric, it's community-centric. So while we're sharing with the agency, we're sharing with the community. What does the community think? What does the community think can change the arrow going down? And what can we do to bring people together more collectively and to broaden our thinking? So we have, again, this is kind of like the dashboard that you can see, progress in kindergarten, protective factors for families, parent behaviors, ability to reach children to reach into the community, reading proficiency at 3rd grade. And so we have both longer term and very short term goals that we're looking at, and we're just sharing these dashboards out. They're not labeled, they're just shared. So it's sometimes the best thing to do is to share the information and say, what do you think? And so that's what we did. And you have in our next slide just kind of one of those organizational structures where, like, what do you think? And you see there's always going to be food involved. Well, that's one of our early learnings, right? Bring food to the table, or have and inspire people, and they're going to come and talk about their children, and they're going to come talk about hope. Talk about opportunities to engage so that their children can succeed. You heard that from Martha more than one time. And do this with a sense of empathy creates an environment where people can really, really look different. So we were doing this as we're going through this process of actively collecting data and reflecting it back on a bi-monthly basis to organizations and to community members. And then we, as you saw on the other thing that we're doing, a community survey. So we selected a small component of those 500 blocks to survey on a regular basis. It's basically an every other year survey. And we developed the survey ourselves using protective factor survey components and other ones that we found across the country. I will say that we developed this with the help of support from the Center for Healthier Children, Families, and Communities out of UCLA. Neil Halfon shop there, if you know Neil, and support from Dr. Moira Inklis, and as well as our own internal group of organizations interested in data and moving this forward. We created our own survey that we went into the community, and we first did this on paper, and then we learned that paper is really cumbersome, and we did this on tablets, and we did this with the help of community members. So we walked those blocks like 1 million times during a 2-month period. Every household in that community was reached out to at least 4 times at different times of day and different days of the week in order to try and collect data. And the survey was simple, but we used community members along with our MCI staff, backbone staff, to help guide them and to collect that data. And then we fed that data back to the community as well as the organizations. So we used a survey postcard. So, the one thing that communities hate is that you survey them and don't talk to them about what the results are. And so we created this card that said, hey, and this went to every household that we found in the community. And by the way, we found some households that weren't on the community rolls anywhere. We found households that supposedly didn't exist in that process. And we would send them back to that. And these are some basic results that they got on like education and neighborhood and family and safety and health. And they were, coded to this community. And so what is interesting is that we took this as a step to loop back to the community. So one, they got the results, then they got invited to a process to learn. So what does that process to learn look like? You know, how do we focus on these things? What do we focus on these things? And so while we created this sense of belonging campaign, how do we get them to join us? How do we want to be part of the bigger picture as you learn from the survey result? And whether you took the survey or not, it was really an interesting process. So we created an environment and then meeting space, and in that we focused on the protective factor. So we'll get to the next slide, and you can see that, you know, we really worked on these things, and we think and we know that the sense of belonging and the sense of civic engagement help balance out protective factors, because sense of belonging speaks totally to social connectedness, and civic engagement speaks to resilience and social connectedness, and it helps them understand where concrete supports are. So we focused on those as we brought community members back together to talk about the survey results. Now, the community members that did the survey, that went out and helped with our staff to provide the survey in the community all these times, led the process. So next slide. So they led the conversations around the survey results. The community members led the conversations. Yes, we were coached. Yes, we talked about the data with them. Yes, we engaged with them, but this was community-driven process. So community members now are sharing with community members. And so you see, here are some of the pictures that we took, and you see kids in the process too, because kids were invited to these meetings as well. And you see men in the meetings as they were invited. And we were bringing people together around building and strengthening protective factors. And so that was an easier approach because it's concrete and people understand the sense of belonging and the sense of social connectedness. And so it was a great way to start this, because what happens when you bring people together, you say, now, what do you want to do about it? What do you want to do? What can you do? How much bandwidth do you have? And we are only providing opportunities for people with small bandwidth as well as some bigger bandwidth. And you have some people that will take the lead and some people that want to participate. But now you have a different level of civic engagement, because people say, okay, I see this as a problem in my community and I want to do something. So because they see the bigger picture. So that was something very significant, and as part of the process. We have not done a survey since 2018. We did it every 2 years up until then. We were getting ready to do the survey in 2020, and we all know what happened then. So we're in the process of getting back to that. And so hopefully we'll be able to emerge out of this in this next fiscal year to have another survey. One other way that we started looking at community is with the early development indexed or instrument, depending on what you're looking at. And so it is a tool that looks at 5 developmental domains of children: physical health and well-being, social competence, emotional maturity, language and cognitive skills, and communication skills, and general knowledge. This is an evidence-based tool that was developed in Canada and used all over Australia, used all over Canada, used in places now in California and in other states across the country. And it's linked to child level demographics. So how does that work? So if we look at the data, it's measured at the kindergarten level or the TK level, and it's a reflection on the children. It's not about the child. It's about the community that the children live in. And so we use GIS mapping. Each child EDI form is geographically coded along to their home address. And the maps allow stakeholders in the community to discuss and address areas of the children's vulnerability. So by doing that, we have a better understanding what's happening in the community. And these are done every 3 years. And we were able to reach out to the elementary schools, some of the elementary schools in our catchment area, and have them do the EDI before it was implemented across certain areas of LA Unified, which it has been done now with the support of First 5 LA. So it does talk about these socioeconomic indicators, and it gives us an idea of where there are service gaps, and it allows us to see change over time. And so if you look at the next slide, it's just kind of a look at what happens. I just wanted to give you an example of the data. So it's really around learning, right? So it's a process. It takes time. So what this tells us is where the most vulnerable are the least vulnerable. So where do we want to redirect our resources or our focus, and how do we engage differently in these communities? And it tells us over time how things might have changed, because that's what we're looking for. And we also use another tool now, and again, using the Center for Healthier Children, Families, and Communities out of UCLA. We look at the next slide, which talks about the Neighborhood Risk Index. And so it talks about community contextual factors that are based on demographic data, parent education, income, all number of children in the family, household income, all that stuff is taken, and it looks at that, and then it overlays onto the population health income index, which is the EDI. And so if we go, we can take a look at how that looks in the next slide, a little bit about how it's reflected in the community. And so we see what we might see in a family with high risk based on the demographics of the family, and then we overlay that with families that are really working against that, if you will, by understanding what the EDI data. So you take, again, risk data based on demographics and actual data based on the EDI, overlay them, and you can see where the sweet spots are. So it allows you to kind of go, what's happening there? And then what do we do more to strengthen this community? What's happening in the communities around Magnolia, where we're seeing actually pretty good data compared to what we might expect? I didn't include the risk index on here, which you would have seen as being a lot more colorful in the reddish, orangish, kind of pinkish areas. But you can see this overlay about how we can look and see where things are doing well compared to what we might think they would look like. So that is just kind of a snapshot of how we look at things and how we've looked at data and how we collect data on community level change, and how we have to think of this as over time and what it means to look at things over time. EDI every 3 years, our community survey every 2 years. How do we take a look at this? Because we're so used to tomorrow. We want our data about tomorrow. So our real-time data is around improvement, tomorrow's improvement, and what can we do better. And then our long-term data is kind of how are we really doing that, and can we really do it over time, and how do we need to morph, or who do we need to look at differently to help support them in a stronger basis. It may be that we need to go create in areas where there's high risk and we're not seeing the level of change that we'd like through EDI. We need to look at how do we find organizations that are living in that context, that have community connectedness, strengthen them to build factors, if you will, protective factors in those community. And I wanted to finish a little bit on this with this slide, because this is kind of the evolution, and this is the pre-pandemic version of a meeting with our community members working collectively to create their own leadership academy. So what they are in the process of doing, and that has been completed even through the middle of the pandemic, a leadership academy that's 8 weeks long for community members that want to learn and be leaders in their community, whether it's a block captain, whether it's a president of a PTA, or a board of an organization such as Children's Bureau. So how do we strengthen them? And this was developed by the community members, again, an 8-week course that's developed by the community members with them saying their own needs and what they need, they feel they need to. Yes, we inform the process because we were able to kind of say, these are the things that you might be asked about to look at it at a board, how to read a financial statement, simple things, but also how to strengthen their own ability to stand up for themselves when they're in an environment that doesn't always provide the grace that they need, and how do we think differently together. So they finished this leadership academy, was finished in the middle of the pandemic, and last year we piloted this academy in the city of Anaheim through a similar work that we're doing there. And we're just now getting ready to implement this at the Magnolia family center in the next couple of weeks. And so we're very, very excited about how to do this differently and what we can do differently in this community. So I'll stop there and turn it back to you, Kush. I know I threw a whole lot at you, but these were just
want to
conceptual framework, right?
I just want to
go ahead, Alex.
add, you know, there are just so many radical shifts that are being presented to you that I'm hoping you're capturing. Today, one of the biggest messages that we hear about our programming is we need to include voices of the community and people with lived experience at the table. And I just want to, and this is how we attempt to address the needs for equity and inclusion and diversity and racial justice. But I just want to emphasize that this goes way beyond having voices at the table. This is using the agent of change in the community is the community members themselves, the ones who represent all of that diversity and are challenged by the systems and work towards racial justice. So this is truly activating and supporting their taking leadership. So it's probably one of the most significant, deep ways that we can really address this call for inclusion and allowing people to be the authors of their own lives without having people from outside of a community dictate how their lives should run.
Thanks, Alex. So, you know, we'll move to lessons learned, but there's some great questions in the chat already that I want to get to. But before I do that, just one question for all of you, and you know, this might mean different things to everyone, but you know, we've talked a lot about going upstream, and we've talked a lot about the impact of going upstream on equity and how equity work must really include restoring health to communities. Did you make an impact on equity? You know, like what's that conversation like? What was it like? What is it like? Anything on that?
You know, interesting. Marta, I hate to point to you. Did you pick up on that question? Did we close the gap, Martha? Did we close the gap between, so to speak, the haves and the have-nots? Or at least get closer to doing that? Like, did the community start to experience, wow, we have equal opportunities and equal access to resources as some of our, you know, more affluent neighborhoods that surround us? You know, LA is famous for that. You've got like Beverly Hills and, you know, South Central right next to each other, actually. So what would you say about that? Like, what would the community say, Marta, before, you know, before the professionals answer?
For me, I think we did. I mean, the resources are there, you know, in the community. It's just sometimes and I speak as a community member, like sometimes we feel scared to take that step, right? To pretty much get out of our homes sometimes, you know. We feel sometimes the language is a barrier. We feel that sometimes we are not being heard, but we are, you know, and I feel that's why these community circles, these programs, these organizations like Magnolia Place has empowered a lot the community. And also one thing that I feel that is the families that we know in the community know us. So they know that we're going there, they feel safe, they know that they are going to be empowered. And just hearing word of mouth is something very important in the community. I think, you know, getting to know each other, getting to know our neighbors, you know, getting connected with the schools. I feel it's very important, you know, getting to know, you know, the clinic, you know, that we have in Magnolia Place, getting to know the doctors and knowing that they know about this change we want to do in the community. We want to make sure that they know that we are here and that we're here for them. So I feel that, the resources are there, and that when we can't find something, we know where to look for it. And that is something that I feel that is very important. The connection, the belonging. We want to feel belong to the community.
Thank
So
you. Thank you, Martha. Yeah. Tara, you have your hand up?
Yes, I wanted to speak to the point of the question about equity that I believe that Magnolia Community Center has done and the change in it. I'm a part of the LA County ARDI, which it's called Anti-Racism, Diversity, Inclusion. We have started couple of years ago, and I can definitely agree to the equity learning. Again, remembering equity and equality are totally different. Equity is starting those that are at the bottom and getting them to the top so everyone sees at the same level, right? It's that cartoon where you see the little carts, right? So I might need $100. Equity is saying this person on the next side might need $200 just to make it to where my $100 would have gotten me, right? And so I can see that. And also what we learn in diversity and inclusion, we always, or I would say for the most part, sometimes we think about diversity and inclusion and we only think ethnicities of diversity and including those. But diversity and inclusion, also diversity and inclusion of ideals. So bringing in the community, as we just saw in the last slide there, would bring it in the community. Our program there, that miniature program, were with the network partners, but then we open it up to actually having a community one where they were heard, where they were seen. Even the county, again, the other partners, we were all at the table. I was made a Magnolia champion. I'm still proud of that I was a Magnolia. I helped to agree to the change of our logo. I mean, I was in the room. My voice was heard, my suggestion, my ideal, my, what I liked, what I didn't like, everybody was heard. So definitely there's been a change, and we saw the data go up from what the community was known, what they knew at first, what were we there, what we did, and now because of their information, we showed them now where we are now. So equity has definitely been a part of Magnolia. Before that even became a word, we were doing it. I always tell them all the time, we were before time. So, but we're still there. So equity is definitely there.
And I'd like to add just, there hasn't been an experience like a pandemic to demonstrate the inequities of our communities across the world, if you will, not just our own local ones. And so we worked very hard to stay connected, to find and keep voice. Interestingly enough, and working with our local community on Zoom, because it's Zoom, you didn't have to be present. We had people coming from 40 miles away calling into our Zoom calls to participate collectively during the pandemic. But it was a time that we all experienced of who has the resources to even find the tools to keep their kids in school, to keep themselves working. There was a whole lot, and we weren't perfect by any means. We started with that language, we committed to that language, and we kept that language going, but it was a difficult time, and we haven't completely emerged out of it, by the way. So we're still, as we continue to evolve, we're continuing to evolve.
Great, thank you. All right, let's move to our audience and see what's on their mind. And I would invite whoever asks the questions to, if you're not feeling too shy, to come off mute, deepen your questions. I'll tee it off, but again, it'll be a little messy, but that's how it is, right? This is part of a demonstration of the dance it's going to be. So I'll take the first question from hi Diane McFarland in Sacramento. Who are and how did you find the informal community leaders that are advising you as to the community names, boundaries, etc.? How do you get them in the first place? Like, send out a bat signal, how do you find them?
Well, we were kind of smart about this from the very beginning. When we decided we needed as the evolution, we needed to engage differently. There was an organization in our community, larger community, that was creating and training promotores. And so we hired, that lived in the community. So we hired some of their new promotores to be part of our community engagement process. And because they lived in the community, they had access to the community and could engage more deeply, and actually brought us other organizations, and we used them as well. So we, we went to the community from the very onset of, once we realized we needed to do this work, where can we get this? And that was a likely place, because they were trained. Now, it was hard for them because they were trained in health issues. So how do we engage them in broader community issues and broader community connection? That was just our own training process. But that's how we got started.
Great, thank you. Anything else about that? Diane, I'll just give a second if you'd like to ask anything else. Go ahead.
Like actually defining the boundaries, like how did you decide this is the street, this is the edge where this neighborhood is, and this is where this neighborhood begins and this one ends?
So the larger boundary, as Alex mentioned earlier, was created as, how do we get county to commit to being in the building? So we had to have a large enough catchment area, but the other boundaries were created by the community members themselves. So just in that messy, you saw that messy map up there. It was actually messier. That was the resulting map. It was far messier going into this. So having people there from those communities helping to define it. And you saw in some of those components, they defined it outside our own boundaries, because, ours were obscure just because of how the county wanted it. So we let them define it themselves. So ultimately, and not only did they define it themselves, they named it themselves. So, and some were names that were already being used in those communities, and others were just by the people that were participating from that. But there were, cadres of individuals coming from those areas to help do that.
Thank you.
Thanks, Diane. Kimberly Epps, Kimberly, you've lifted up that there's a program you have in San Bernardino known as Operation Phoenix, but sadly looks like didn't sustain beyond the city election. If you're still here, and for our team, how do you negotiate elections and the politics and all of that, right? You've done this how many years? How many administrations? How many supervisors? How'd you do that?
Alex, you want to tackle that? And
Well,
Tara?
It obviously has had a life strongly since 2008, even though probably another 1 or 2 years before that, a lot of the seed work was going on with that. We have just been able to sustain relationships with a variety of leadership at the CEO's office that has transitioned from time to time, and sustained leadership particularly with the Department of Children and Family Services. Have positive working relationships with that department, even though its leaders have changed over time, and been able to sustain good relationships with the Board of Supervisors, who have changed their positions over that era. And as mentioned before, the 500 blocks actually involves several Board of Supervisors who are connected to those geographies. So it has relied on speed, really moves at the pace of being able to develop trust and being able to develop partnerships. And this initiative has tremendous credibility of trust and tremendous capacity for maintaining partners and bringing in new relevant partners.
Tara, let me tap you. How did you know, at the county level, there's a tiny bit of turnover from time to time, as we can imagine, right? Like different bureau chiefs, and all of a sudden, like the great idea doesn't have support anymore. How did that get negotiated from the county side?
Well, I would say because it came from CEO, right? Our chief executive officer. Every department wants to do what the CEO puts intact. You know, no department wants to go against CEO. So that, I guess that helped us, or the departments, when there was a changeover in management, because actually my department director changed in the middle of this also. But there was the new director. However, when you say it came from CEO, and so it's very good when it comes from the top up, the top down, right? Because then that it has more power, more weight with it. And so even though even our CEO changed because of the relationship we had with the one that took over that spot, from DCFS, I think Miss Physia Davenport, right? She took over now as chief executive officer, but she was already in partnership through DCFS. So it's very important to have those relationships bonded in particular, I guess, in particular, maybe departments, because they can change, but when they move up, it's still a part of their makeup. It's part of what they want. They come from this. This is the children, the family. This is something you don't drop. You don't drop the ball on children, right? They're our future. So it's very important to keep those relationships. And I think that is what helped the county to stay intact, because we're still there. Our departments, all those 3 departments, maybe different persons. I'm the only one still there from '09. I would proudly say I'm an OG, but but I do believe that all of our departments are. That I know that they are still there, and that's one of the things that was a catalyst and a help for us.
And I asked Tara to comment because there have been times when I get an email from Tara, do you know that my department head's changing? Can you invite them out and let's have a conversation about making sure that they're behind this too? And then, of course, that means we reach out to the CEO's office to make sure there's a support structure.
Great, thank you.
And sorry,
go ahead, Dan. No,
we're not getting government funding for this. So there isn't any, ownership coming out of a government entity that says, I own this and I'm going to help control it. So because of that, it actually is empowering and allows us to do more things and be more creative in our approach. As we talked about, it has allowed us to evolve in different ways than we might have ever thought of had we had a direct funding source.
I think the significant contribution that government makes is, one, loaning its power and credibility, and the placement of these 3 departments. Their staff are placed in the initiative and supporting the work of the initiative. So they allow those staff to have tremendous flexibility to respond creatively to the work that's going on there. So the government is not giving financial dollars for some of the expenses of the backbone functions that need to be addressed, but it is funding the positions such as Tara and allowing her to be physically there.
And I would say too, we have every county department, we have MAP goals, which come from CEO. And so by us being that helps us to fulfill a lot of those MAP goals that that chief executive office is asking of those departments. So it cuts down just in that one spot on a lot of the MAP goals that we need to accomplish and to provide to CEO that we're doing. So that helps us also.
So what do we think? So this no funding is not quite the case with Families First Prevention Services, or FFPS. There is a state block grant that some of you are grappling with how to spend and write a CPP around. What impact, and this is conjecture at this point, because none of us have a crystal ball, but based on your experience, what do you think what's going to be the impact? What do people need to be careful about, given there is funding? I mean, it may not be, the amount we want, et cetera, but there is funding. What do we think the impact of that, and what do we have to watch out for?
I certainly can share my opinion. Is there anybody else on the screen that wants to share theirs first?
Well, I can just comment that when there have been many philanthropic efforts as well as public dollar efforts to start community initiatives, but their longevity is the length of time that the funding is present. And this one was not built on that foundational beginning. It was built on an invitation that we want to do something as Children's Bureau to try to improve the lives of the children and families in this community. But we have limited resources, but we have full commitment of our organization to want to direct those to make this change. But would you like to do that too? And so it was built on commitment and missional blended sharing and ownership of what happens. And then you begin to align the resources you have to make this successful. So when money is on the table, it usually distracts, well, who's in charge and who's going to get the money and how much and why didn't I get my share? And that contaminates the process of the missional commitment that's the deepest part of sustainability. And the other part that Ron has often punctuated, that sustainability comes from the ownership of the families who live in the communities and their ownership of the welfare of their own families and their neighbors' families. And building and deepening that is where the heart of the resource. So money is important, but as a starting point, it can contaminate the process.
I couldn't have said it any better than Alex. Thank you, Alex.
Looking at, just let me check the chat and make sure that, somebody is asking for some more information on the Parent Leadership Academy. Where could they find more information on that?
Yeah, I'm gonna, I made a note and I'll go back and check to see whether the group that put it together is comfortable with sharing it out. And then I just need, Kush, I just need a process to get that information out.
Okay, so we'll make sure that we get it out to folks as part of our follow-up.
Yeah,
that
I'll at
Catherine
least
does with
let them
folks.
know that it was followed up on. If I can't do it, if the group that put it together isn't comfortable, then I'll just say it's not ready for release. But if I have it, I definitely will do that. I just don't want, it's not my decision. Right?
Great.
Yeah.
So let's move. I don't see any questions yet in the chat, although folks just raise your hand and we'll pause where we are. Any other questions?
Cynthia, there's a question on chat from Cynthia. Cindy?
Yeah. Can you explain the CEOs? Is this position at the county level, the county executive officer? So maybe just sharing a little, maybe how the structure works in this complex LA political landscape.
Actually, they answered that.
Oh, great.
I got it. So thanks.
Okay, great, Cynthia. Thank you. Other questions? Before I move us to, okay, so here we are, couple of decades later. What would you lessons learned? What would you do differently? One piece of advice you could give our audience today, right? What should we be paying more attention to than other things with regard to what you said? Like what, some lessons learned.
I think it's as the vast majority of the people participating in this discussion are from the public sector. This initiative originated from the private sector, and the public sector became a partner in this in a substantial way but it did not lead it. So the challenge to the public sector who's on this conference is how can they be part of a spark to creating a shared ownership space that they do not themselves lead or own or take charge of through money, but they participate as a partner and they stimulate other partner organizations to come to the table and perhaps take that leadership. And how do they involve some organizations that operate at the grassroots level that have deep history of connections with their neighbors and community? So it's that initial step of how you begin that I think is an important challenge that uniquely in the case of the Magnolia Community Initiative got started in a sound way, but now you as head of your efforts for your prevention planning teams are operating from the other direction. So how do you create this shared space in this way?
Marta, would you have?
Yeah, I was going to go to
reflection?
Marta too.
Yeah.
Marta, what have you learned? What reflections do you have? What advice do you have for folks that are gonna be filling shoes like yours, and for the folks that are going to be supporting them?
For me, type of advice is, to open the doors and, hear them, to learn what their strengths are, what they could bring to the community, because, sometimes we are scared, to show what we know, what we could bring to the table, because, education could be a barrier or, stuff or language, but we really have a lot of families in the community, members in the community that know a lot, that they could glow. And I feel that bringing the community could make a difference. We want to make sure the community feels welcome and heard and a place of trust. If they see members, they go with them to the school, to church, to, to their market, they're like, this is a place, if she's making a difference, I can make a difference too. They're not going to be scared. They're going to feel trust. They're going to feel that they're being heard and welcome. So I think, that has, personally helped me. I was first hesitant to be a volunteer, to be a parent facilitator. But the way they just, helped me embrace and feel that I could do it, to say that you are important, that I could do something. I feel that a lot of our community members need to hear that from them and feel that, we're welcome, feel that we could be part of a change and belong to it. And I think that's something that I feel that has helped me personally and hear from many of our families that belong to the program that are making a change in the community, that they're saying, thank you for doing this because now I could do here, go back to school, learn English as their second language, empower them to, even to like right now during the pandemic, a lot of our families didn't have emails, didn't know what Zoom was, right? Didn't know how to help our children go to school virtually, right? We were parents, teachers at the same time with a lot of our children at home, and I saw how our families embraced that. They weren't scared to be that support for their children, to ask for help when they needed it, so I feel these programs and these, Magnolia Place has empowered many families. We might not be able to capture it all, but we are making a change. We are making a difference in our children's lives and our families' lives. We need more of these programs in the community.
Thank
Thanks,
you, Mark.
Martha. Tara, sorry.
No problem, no problem. And just to back to the point of Marta, I think the biggest thing that really spoke volumes to me was that Children's Bureau was a community center. But not only that, when I found out, I don't know if Alex or Ron knew it, but when I first came, of course I was speaking and engaging with Alex at that time was the president. I did not know he was the president. And when I found that out, I was like, oh my God, this is actually the president. This is your headquarters. My headquarters is not in my community. Okay. So because Magnolia Place was not off in the resort area and the president and CEO was doing what they did and came in every once in a while, this really spoke what a community center and having them engage. I could actually be in the community and see and talk to Alex, talk to the community people, and it was I can't even explain. When I found that out, I was so amazed. And the other thing I would say to the persons on Zoom here and is to make sure that whatever you come in as when you're building this is that one of the questions we had to keep asking ourselves, what is your goal? Your goal must align all together. If you're giving money and that's just your only goal, make sure you know that, right? If your goal is really to be a partner to work in, make sure whatever your goal is, it's the goal that's aligning with the entire initiative of whatever you're going to do. Because if not, that can stagnate the process, that can delay it, it can even stop it. So your goals must be the same goal. You have to know what is the goal of it. We want to do a lot of things, but if we don't really know the goal, we're doing a lot of things and hit no targets. So I would say that you flush out really, what is my goal in this? What goal do we want to see? Then you can see, are you reaching it? Are you hitting your target? So that's what I would leave with.
Thank you. And so Ron, I'm going to sort of steer it back to you to answer this question. And then maybe just give us a little preview into sort of what's the next decade look like?
Yeah. So thank you, Kush. And this is what we've learned is it's messy work. What you didn't get are all the hiccups and all the mistakes and the problems and the questions and the things that didn't work out right. What we tried to give you is the ones that did. The one things that I learned, and it's up on my board in my office and will remain there forever, I think, is that context matters. And honestly, we're not context experts. People like Marta that live in the community are the context experts. And so they have to be engaged with and for any kind of change that we hope to make and hope to work with them to create in a community. And if it's about money, it generally isn't always about being sustainable. So what other approaches can we do to help improve? Finally, creating a vision that everyone can share and that they can be committed to. Back to Tara's comment, the goal is a shared vision. And you can come together around a shared vision, you can get through a whole lot, because if you agree on that, you're only going to disagree on strategies in getting there. And of course, those are going to be whatever the context means. So it's really hard work. It's hard, messy work, but it's like the most satisfying work I've ever done in my life.
So what's next? What's next in Magnolia Community Initiative? Are we expanding out another 5 blocks?
No.
What's going to happen?
So we're like all of you, we're trying to recover from the pandemic and see what that looks like. And people have moved and things have moved on and changed, and we've learned things and we've lost things. And we just need to kind of recoup. From a Children's Bureau standpoint, we're building a new facility in the city of Palmdale that's much like the Magnolia Family Center with co-located space. But unlike Magnolia, the community there is very, very spread out and far different. It's not people living on top of people in apartments. It's all over. So we have a different context. So for us, it's learning that too, taking what we've learned in a very dense population and taking it into a very, very not dense population in any way, shape, or form is there. And then just recouping, re-engaging, as I mentioned, the Leadership Academy and where that evolves. And we have now taken MCI's approach is that around now very focused on innovation. So what can we create and learn out of MCI that we can share with others and other places is our goal for the future at MCI.
Great, thank you. And, just want to lift up one of the chats that Dana put in the in the chat, that sort of behind everything you're saying is that proximity, whether that is geographic proximity or cultural proximity, it makes a difference. And so to be able to map out sort of, well, what is proximal and what is not proximal, like that's the work that folks have to do. And I know that geographic overlays right now are tough. Folks are selecting their target populations for their CPPs. They're struggling with what is proximity, what is not, what is place-based, what is not. But I'm going to misquote this study, and some academic on the call is going to send me the link and tell me I misquoted it. But there was a study I remember where they looked at neighborhood crime and they controlled for a whole bunch of stuff. And one of the things they found made a difference was whether people knew their neighbor's name. And I'm just, that study keeps coming up as you all are talking.
Yes.
So, is there anything else from anyone? I mean, this is just, it comes to life. When we don't talk about it, we talk from it. And I really appreciate that you all did that today for us. It's going to the pictures will be different. Like the composition and the colors of the individuals may be different, right? But the principles are the same. I know your neighbor's name. Invite them to the table. Eat with them. Ask them what they need. Right? Yeah.
Find their strengths.
Yeah.
Empower them. Have empathy.
Really great. Well, I don't see anything else in the chat. I'm going to turn it over to Caltrin to bring us home as our gracious hosts.
Thank you very much, Kush. And thank you to Ron, Alex, Marta, Tara, everyone, all of you for sharing your story of really how you developed this initiative. And I'm so glad to hear that it's expanding, and I'm sure it's exciting to have it move someplace so different. So again, thank you for sharing this morning. So Kush, if you want to put that last slide, perfect. Thank you very much. So thank you for joining us this morning. So what's next? We will drop the link to the survey, which will give you the attendance certificate in the chat right now. Thank you, Haley, for doing that. Please go ahead and register for the next part of this learning series, which is going to be on building the community pathway. And so we've got that link dropped there. As Jess told you earlier, within about 2 days, you'll get the email from Caltrin with the recording, the resources, the slides, etc. So look for that, by the end of the week, and then watch your inbox for the next issue of Caltrin Connect on all of our other trainings. You can go to the website, caltrin.org, and see all the other things that we have coming up, always free, as we are a state-funded project. So again, thank you very much, and thank you for joining us for today's Learning Forum.